Hello there, ladies and gentlemen. Welcome to another program in our series, Global Connections. Today we're going to do something different. We're going to talk about medical tourism. Have you heard of that? Medical tourism seems to be coming, I don't know if the right term would be coming into its own, but we're certainly hearing a lot more about it. And my guest today is Dr. Timothy Kosinski, who is going to be my expert here as we talk about it. Dr. Kosinski is a dentist who has worked all over the country in lectures and teachers and so on, and of course naturally is very interested in this. What do you think is the advantage of going abroad to have your surgery or your dental work, whatever it might be?
Well, that's a great question. It's a great topic, and an interesting topic, something that kind of you don't think about all the time. Mm-hmm. And obviously with the economy the way it is, it's hard for people to afford certain type of work. And dentistry, unless you're in pain or swollen, can be neglected. And people are always looking for ways of cost savings. And
it's funny because I think historically, going back my entire life, people have always said dentists, and they back off when you mention the word dentist. I don't know whether it's the cost or the pain they worry about.
Well, that doesn't happen anymore. Those days are gone. Those days are gone. It's technology has dramatically changed in dentistry, mm-hmm. and there's really no reason why people should have fear of the dentist. And maybe that's another reason why you wouldn't be afraid to go to another country to have dental work done. If you think that through, you know, the dentist relationship with the public is very unique. You're very trusting of us.
Yes.
And we've earned a certain amount of confidence in our abilities, and as technology improves, our techniques. Mm-hmm. But there's no reason to be afraid of going to the dentist anymore, that's for sure. Okay. We don't hurt anymore.
Okay, well that's very good.
Yeah.
But now, other advantages, I've looked at costs, and if you go into the internet, you can look it up yourself. But you look at the costs, and it seems as though there are certain areas where they specialize in dentistry, in particular in implantology. In Europe, they've got several countries. London is certainly one, but the one that amazes me is Budapest, Hungary. I mean, would you think of Budapest, going to Budapest in Hungary? What would be the advantage?
Again, I think it all comes down to cost. If you feel that you're getting better value by going to another country, that's why you may go. But there's positives and negatives, and I think the public out there needs to be very aware to look at the entire package. They need to compare apples to apples. Mm-hmm. They need to know exactly what needs to be done. For instance, dental implants. Now, let's not talk about dentistry. Dental implants are very popular today, and an implant is a piece of metal that's put in the jawbone that simulates the root of a tooth that allows us to anchor something to it. It could be a tooth, it could be several teeth, it could be a denture. So, but the perception is dental implants are very expensive. Why do we have that perception? Because dental implants historically have been very expensive. But as technology has advanced, the cost of dental implants for the patient has come down dramatically. Is it still affordable? Well, maybe or maybe not. But again, I think you need to discuss with your dentist, your general dentist, for instance, and find out exactly what needs to be done. And then you do your investigation, and you do what's right for you as an individual. But if you're going to travel to another country, obviously there's travel expenses. Let
me ask you something, because you dropped something and it hit here. You said something about implants of dentures.
Yes.
You mean you can get the old false teeth bit?
Well, for people that have false teeth, they move around, they hurt,
yes.
They can't function, their chew efficiency, they can't kiss, they can't go to a restaurant, it hurts. We can actually simply put 2 implants in the lower jaw and attach a denture so that they have to snap it out. But it doesn't move. It doesn't move. It doesn't wiggle.
Well done.
Well, thank you. I've done it before. But it doesn't move, and it improves the quality of life dramatically at minimal cost to the patient.
Okay.
We have mini implants. There's so much out there, and the point I'm trying to make is you have to know what you're getting.
Right.
An implant is not an implant is not an implant. Experience is not experience is not experience. And it's a big deal. Any type of surgical procedure is invasive.
Well, I've read, for example, that, and maybe some of you have read the same thing, that there are people that go for surgery to India, and they have surgeons in India that are trained in the United States, are very good, and they put enormous wealth into these clinics, and they're luxurious, and they do everything, and you go over there, and you have your surgery. Now, there are a couple of things that I wonder about is, if you go to India, will Blue Cross pay?
I would probably say not.
So, that would make a lot of difference. I go to a hospital here, whether it be West Bloomfield Ford or Providence or whatever, and I go in for surgery and Blue Cross covers me. But if I go to India, what happens? I mean, obviously I'd have to investigate it because I don't know the answer. But I would think there'd be a lot of negative points. I mean, if your son or daughter needed surgery, would you consider going abroad?
The answer is unequivocally no. Knowing what I know, being in the medical field, you hunt out, you search, you educate yourself. The public needs to educate themselves to find the best person that they feel comfortable with. And you have to know the intent of that professional. We're a profession. We're not technicians. And you have to know the intent of that professional, and you hunt out the best that you can find in your community. But it's very important that you take it upon yourselves to educate yourself and know what's going on with your body. And if we go back to dentistry, it's important that you know what needs to be done and who's going to do it and who's going to guarantee it and who's going to warranty it. When things go well, it's not a problem. But what happens when something doesn't go right? When there's complications? Can there be complications with implant dentistry or with dentistry? Well, of course, it's an invasive procedure. Is it rare? Of course, it's very rare. But implants do fail. So what happens if you go to India and you come back to the States and your implant fails? What do you do now? You can't get it back on a plane and go back to India. You're going to see a local dentist who's going to look at it and say, what is this? Is it FDA approved? Well, probably not. It doesn't have to be FDA approved. It was done in India or in Hungary necessarily. There's also many different, in the United States, there's probably 150 different types of dental implants. Which type are you getting? Is there different qualities? We've talked about this before. Is there a difference between a Cadillac and a Buick and a Chevy? Well, they all have four wheels. They all get you where you want to go. But are there differences? Well, I think you can say yes, there are differences. Maybe the quality of the materials, the quality of the leather, the quality of the components in the engine last a little bit longer. The same holds true with dental implants.
Well, I was thinking, for example, about the number of women that go abroad to have their babies, or they go abroad to have their whatever gallbladder removed or something like this. And I think the potential for repercussions could be quite grave. That would worry me a lot. If I were going overseas. Certainly the cost is attractive. I was looking at the cost, for example, for implants. And for Hungary, it was something like $1,200 for one implant. Okay, now that compares with $4,000 for an implant ordinarily. And that would be something that you'd have to be very, very watchful of because you don't really know exactly what's going to happen. So I go over to Hungary and I pay my money and I pay, well, let's say I'm getting implantology. It's implants I'm getting. I pay my $1,200 for one, and I want three, so I'm now dealing with $3,000. But oh boy, that's wonderful because that's compared to $15,000 for 3 or 4 here. and then I get back, and something is not quite right. If it's a different technique that they use, how much of a problem is that? I mean, I can understand if all of a sudden you get an infection and there's whatever happens. But if it's a different technique, or the size of the screw that goes into the gum, I mean, can you spot that? Can you tell?
Well, that's a great. I understand what you're asking me, and it's a very interesting, because I have patients that do travel around the world and come to me. When things go right, it's not a problem, but nothing we do is going to last forever. Mm-hmm. What happens when something needs to be changed? An implant, when you think of an implant, you think of a tooth. You referred to that a couple times. But that's not, as dentists, that's not what we think about. An implant is the part that's put into the jaw. Then you have a part, we call it an abutment, a big word, means it's a part that threads into the implant. All our implants are internally threaded. So there's a part that goes inside that locks in. And then the third part of an implant, in your perspective, is the crown. So when you're talking $4,000 or $3,000 or $2,500 locally, you're talking about all three components. So when you call on the phone and it says how much you charge for an implant, you're thinking tooth. As a dentist, I'm not thinking tooth. I'm thinking only of the metal stud. Very important, okay? So that you don't get a bait and switch. Now you come back and everything's fine for 10 years. Now you come to my office and you say, it's broken here, it's loose, can you fix it? Where do I get the parts from? Where did it come from? You know, it could come from Israel, it could come from Hungary, it could come from China, it could come from India. Those components may not be available. So sometimes we can't repair what was done somewhere else.
You know, one of the things that fascinates me as I go into my reading is they talk about an implant, and you've made a point that I hadn't thought about, that the implant is actually several different things. And I remember now noticing that they made a difference, they made a distinction between the implant and the crown. So when you look at it and it's $1,200 for the implant, yeah, but how much is it going to be for the crown now? So, I mean, all those things.
You have to add everything together. And you know, if you become educated, we've said that a few times now, if you trust your dentist, I think in this economy, it's best to discuss it with somebody that you trust. Mm-hmm. And whether it be in Budapest or wherever, it's somebody that you have to trust to work on your mouth. And if money is the biggest issue, then I think it's important that you discuss with your dentist. Or there's the dental schools. We have two phenomenal dental schools that do implants. The students have that in their training, where you can save a lot of money also and stay local. So there's always options out there. There's teaching programs. I have a teaching program where where we find specific situations where we're able to courtesy out the work dramatically. So going overseas, going to London.
What does that mean, courtesy out the world?
It could be much cheaper. You threw out a number of $1,500. Well, maybe I can do an implant for $699, depending on the situation. That's not for everybody, but we're always training dentists. We're training young people how to do what we do. The dental schools will discount out the work dramatically. Okay. So I'm not dismissing traveling abroad, because maybe you want a nice vacation too. But again, I think it's important that you really understand that it's a little more complicated than just putting a piece of metal in the jawbone and then gluing a tooth on.
Well, you know, Tim, I've had surgery abroad. I mean, I was born in Scotland, and I've had surgery abroad. And if I were to compare it to the surgery I've had here, there's simply no comparison. There is simply no comparison at all. Now, on the other hand, if I'm going to some of these centers that are supposedly very luxurious and so on, maybe that would be different. But what I'm thinking is all of the attendant costs. So, yeah, and you said you might get a vacation out of it. Maybe you would. if you feel like having a vacation after you've had surgery or a baby or an appendectomy or a gallbladder or whatever, and you're in India, that's fine. But you've got the fare. You've got to get over there. You've got to get your passport. You've got to make all the arrangements for your visa. You've got to have a hotel. You've got to know how you're going to get from the airport to the clinic or the hospital or whatever it is. And then after that, there's always that period of time, and maybe only be a day, maybe 2 days, or maybe a week, where you're recuperating. You know what I mean? If I have dental surgery, and I'm probably wrong, but I think of dental surgery as less dramatic than cardiac surgery, okay? Now, I would expect that if I have a lot of dental surgery, I am not going to be ready for anything the next couple of days.
That's because you like to eat.
Yeah. Whereas if it's heart surgery, then I'm going to be there for a longer time, I would assume. So, you know what, ladies and gentlemen, when you think about this, and medical tourism is becoming very, very big. I taught my nephew's best buddy in England has become a doctor, and he talks about the number of patients that he has that come from the United States. But I worry about my doctor, my dentist. Don't you have your own doctor? Don't you have your own general practitioner and then maybe your own specialist? Do you want to go to somebody in Nairobi or somebody in wherever in India? I'd be very hesitant about that.
Well, again, if you look into the details, look at the credentials of the doctors. You should always look at their experiences. And now with Google, it's easy to find things out with the internet. But you want to look at credentials. You want to know what their experience. You should be asking that. How many have you done? And are you getting an honest answer? The facility itself doesn't impress me. Are they going to massage your feet while they're doing your dentistry? That's fine if that's what you want. But is that what you're really looking for? You're looking for high quality at a fair price. And you can get that here. You can go to Florida and get it. You can do it right here in Detroit. There's many very, very prominent professionals that can do great work for you. And I think communicating with your doctors or your dentist specifically is very important today, because we have big hearts. We're trying to help, and if we can't help you, we try to find people that can. And now's the time we all need to help each other to provide proper dental care.
Well, this is a question of language too. If you're in another country, do you have somebody who is absolutely fluent in your language? I saw in a hospital here, as a matter of fact, an Arabic woman, an older woman, who was on a gurney and moved around and fell off the gurney right in the hallway. A nurse rushed up, but she couldn't figure out what was wrong. And naturally, the old lady was talking away in Arabic, trying to explain what the problem was. There was nobody there that knew what it was. And I tried to put myself in the same position and say to myself, okay, I'm going to have my Achilles tendon repaired, and I'm going to go to Bucharest or Budapest or wherever. Am I going to be able to explain everything, and will they understand everything so that I can be taken care of? That's something I worry about a lot. Do you find as a dentist that it's sometimes difficult to tell just what is wrong?
Of course. There can be a language barrier. There can be an education barrier. There can be a lot of things. And again, that's why you develop a relationship with your dentist. It's a very, very special bond with your dentist. And most people love their dentist. Most people never think about leaving their dentist. People have their dentist for 35 years until they're ready to retire.
Or die.
Well, thanks. But it's important that you feel comfortable. And there's not a right or wrong answer here. And I think it really becomes a money issue and what's in your best interest out of your pocketbook. And if it's a simple procedure and you went to a foreign country and you were able to save $1,000 or a couple $1,000s on work and you're happy, fantastic. But if you do the same procedure and you're not happy, it's going to cost you a lot more to have it redone here. You're going to pay twice. You're going to pay somewhere else and you're going to pay here. So, and I do have patients that come from Russia or from Poland or from Israel that have issues. And the answer is, but I paid a lot of money to have this done. Now you're telling me I have to do it again. But that's not my fault. We have to correct a medical problem. And dentistry, like medicine, you can't ignore things. Things can become very serious in the mouth. It's only a few inches from your brain. So you have to take it serious and you have to take control of your own body.
Well, that's frightening.
Well, I didn't mean to frighten you, but
when you said it's only a few inches from your brain, I thought, I hadn't really thought of it that way, but you're absolutely right.
And it is still surgery. It's still surgery.
And I noticed that, for instance, in dental offices now they're checking for oral cancer.
A lot of oral cancer
like
checking, yes. Very, very serious, yes.
How common is that?
Oral cancer is uncommon, thank goodness, but unless it's you, then there's a problem. And so we as dentists have taken a very conscious role in determining. Oral cancer is rare, but it's very, very bad when we find it.
Keep that in mind. Make sure you're checked out carefully. Let me ask you about the organizations to which you belong. How did they react? I mean, if it's the AMA or the, I don't know, is
ADA.
that ADA? There is an ADA,
Yeah.
okay. American Dental Association. How did they react to patients going overseas? I mean,
Well, I think any.
Are they negative about it?
Well, I don't think we're negative. I think the dental societies that we belong to, whether it be the American Dental Association, they do have international components. We do have a lot of very qualified young people that are trained in the United States, but their goal is to protect and to represent American dentists or Michigan dentists. The American Academy of Implant Dentistry, which is a big implant organization that I belong to, has a huge international following.
Really?
When we have our conventions, a vast majority, a vast percentage are from other countries because they want to learn what we learn. I think the United States has the best medical care and the best dental care in the world. We're the leaders in technology, we're the leaders in procedures, so we're very good. Anything new, and I wanted to make a point, anything new is expensive. Well, implant dentistry has been around 30 years. It's been around longer than that, but our modern implant dentistry has been around over 30 years. It's not new, and I kind of related to LASIK surgery. Do you remember LASIK surgery? It wasn't that long ago where it was very expensive and very unique, so to speak.
Yes.
But it's come down in cost. And I challenge people to really check with their dentist. It's come down in cost. Our implant procedures are the whole tooth. It's not that cost prohibitive. That doesn't mean it's everything is relative, but a single implant tooth is probably as expensive as a conventional bridge where we grind the teeth on either side. So it's relatively speaking, the costs have come down dramatically. So I challenge people to go out there and check and compare high quality professionals to make sure they're doing the decision that's right for them.
You know, I look at television stars and movie stars, and they have this row of piano keys that's just so beautiful and pure white, and I think to myself, oh, why can't I get that? Now I could, I suppose, if I get all my teeth pulled out. Is that what?
Well, most of those people have veneers or crowns, And it's dentistry, and that's what people want. You pay for that service, yeah.
So they can have a veneer on it, is that it?
A veneer is just a facing. A
Are you
veneer is
allowed
a
to
facing.
eat then?
Absolutely, absolutely. A lot of dentists, it's done right there while you're sitting in the chair. It's all done by computer today. As I said, the technology is just so amazing. It's just going so fast.
The last point that I wanted to make was the stem cell. Have you read about this? There was a particular case that struck me. They took stem cells and they grew a trachea. The man lost his windpipe in here and couldn't speak and all the rest of it. It was a mess. And they took stem cells from him and grew another trachea, put it in, and he's doing fine. What's the chance of doing that for teeth?
Well, I think it's on the horizon. I think research is being done. I think it's something that maybe in my lifetime we will see, as opposed to putting a piece of metal in. I've talked about it my entire career. I've been a dentist for 27 years now,
And
it's coming. And the technology it advances every day. If they can create a sheep, they could certainly create a tooth at some point. So the science is there. Now the technology has to catch up with the science.
Tell me, who does the dentist's teeth?
Well, the other dentists.
Now, do you have your own dentist?
I have a dentist, and I treat a lot of dentists, a lot of staffs, and a lot of wives. Dentists don't like to treat their own wives if they can help it.
Oh, I can understand that. Just my last question is, as I look at the notes and so on, you said do the research. So in other words, an educated consumer is the most important idea.
Absolutely, absolutely. Cost is going to be a factor, but investigate. Find out who the best of the best are. Find out their prices. Negotiate if you have to.
Okay.
As dentists, we have big hearts, and we want to give back to the community, especially as hard as we've been hit in Detroit. Okay. Now is the time for us to give back to the community. We'll be remembered later.
Now you have a website and so on. What's that website?
www.smilecreator.net.
Yes. Okay.
.net, and there's a lot of information on there.
Okay.
That's real helpful.
You even have little videos.
We have videos, a lot of things, our teaching program, and all of that.
There you go, ladies and gentlemen. Thank you very much, Dr. Tim Kaczynski. I appreciate it.
Appreciate it. Thank you.
Bye-bye, ladies and gentlemen. And remember, think globally, but act locally. Bye.